If your heart quietly stopped beating tonight, would you know why? Most people imagine a heart attack arrives with crushing chest pain, dramatic warning signs, and enough time to call for help. But the truth is often far more unsettling. Many serious cardiac events happen while a person is asleep, when the house is silent, the lights are off, and everyone believes the night is peaceful. What makes this especially concerning is that, in many cases, the risk isn't created by something dramatic. It can be influenced by a series of ordinary evening habits that slowly place extra strain on an aging heart over months and years. I'm Dr. Will, and after decades of caring for patients with heart and vascular disease, I've learned one lesson that stays with me every single day. The heart rarely fails without leaving clues. The challenge is that those clues are often so ordinary that people dismiss them as normal parts of getting older. They assume feeling tired, eating late, snoring loudly, or waking up thirsty are simply inconveniences. Sometimes they are, but sometimes they're signals worth paying attention to, especially after the age of 60. Our bodies are remarkable. During sleep, the heart doesn't simply rest. It enters an important recovery period. Blood pressure normally falls, the heart rate slows, and your blood vessels relax. Think of it as your body's overnight maintenance program, quietly working to repair the wear and tear of another day. When everything functions as it should, this nightly reset helps protect your heart for years to come. As we grow older, however, that process doesn't always work as smoothly. Blood vessels naturally become less flexible. Long-term conditions such as high blood pressure, diabetes, or elevated cholesterol may place additional stress on the cardiovascular system. Even if you feel healthy during the day, your body may be working much harder than you realize while you're asleep. That is why I encourage my patients not to think only about what they do during the day. Your evening routine matters too. The decisions you make in the final few hours before bedtime can influence how comfortably your heart works through the night. Now, I want to be very clear about something. No single habit guarantees that someone will have a heart attack or a stroke. Health is influenced by many factors, including age, genetics, medical conditions, medications, and lifestyle. But there are common habits that can increase stress on the cardiovascular system over time, and fortunately, many of them can be improved. One question I ask almost every patient surprises them. What time do you usually eat dinner? Many smile and tell me they eat whenever life slows down. Sometimes that's 8 o'clock, sometimes 9, occasionally even later. After dinner, they watch television, scroll through their phone, and head straight to bed. It sounds harmless because millions of people do exactly the same thing. But here's something worth thinking about. After a large meal, your digestive system needs extra blood flow to help process food. Your heart responds by working harder to support digestion. If that meal is especially heavy, fried foods, rich desserts, oversized portions, or meals high in sodium, your body has even more work to do. Now imagine asking your heart to perform two demanding jobs at once. On one hand, it's trying to help digest a large meal. On the other, it's supposed to transition into its normal overnight recovery mode. For younger adults, the body often adapts without much difficulty. But for older adults, especially those living with high blood pressure or underlying heart disease, this extra workload may not be ideal. Research has suggested that eating large meals close to bedtime may affect nighttime blood pressure, sleep quality, acid reflux, and blood sugar regulation in some people. Those are all conversations worth having with your healthcare provider if they apply to you. That doesn't mean you must skip dinner or fear every evening meal. It simply means giving your body enough time to digest before lying down may be helpful. Many heart specialists recommend finishing your main meal several hours before bedtime whenever your schedule allows. It sounds almost too simple to matter. Yet some of the biggest improvements in long-term health begin with small, consistent changes rather than dramatic ones. But dinner isn't the habit that worries me most. There is another evening mistake I see again and again, one that many intelligent people make with the best intentions. They believe they're protecting themselves, when in reality they may be leaving their heart vulnerable during the hours it needs support the most. And that is where our conversation becomes even more important. Many people assume that taking their medication is all that matters. In reality, how and when you take certain medicines can be just as important as remembering to take them in the first place. This is especially true for adults over 60 who are managing high blood pressure. If you take medication for hypertension, One simple conversation with your healthcare provider about timing could make a meaningful difference in how well your treatment works. Your blood pressure isn't the same all day long. It follows a natural daily rhythm called a circadian pattern. In healthy individuals, blood pressure typically rises in the morning as the body prepares to wake up, stays active during the day, and gradually falls during sleep. This nighttime drop gives your heart and blood vessels a chance to recover after hours of continuous work. However, not everyone experiences this healthy pattern. Some people continue to have elevated blood pressure throughout the night, while others experience unexpected spikes during the early morning hours. Doctors sometimes refer to this as nocturnal hypertension, and because it happens while you're asleep, many people don't realize it's occurring unless they undergo specialized blood pressure monitoring. This is one reason routine checkups are so important. A normal blood pressure reading at your doctor's office doesn't always tell the complete story of what happens while you're sleeping. If you've been prescribed blood pressure medication, never change the time you take it on your own. Different medications work differently, and what is appropriate for one person may not be appropriate for another. Instead, ask your physician a simple question. Is the current timing of my medication the best choice for me? That brief conversation can help ensure your treatment matches your individual health needs. Now let's talk about another issue that is often dismissed as nothing more than an annoying bedtime habit: snoring. Families joke about it. Couples laugh about it. Many people simply move to another bedroom and assume the problem is solved. But loud, frequent snoring, especially when it is accompanied by pauses in breathing or gasping during sleep, can sometimes be a sign of obstructive sleep apnea, a condition that deserves medical attention. Sleep apnea occurs when the airway repeatedly becomes blocked during sleep. Each pause in breathing may last only a few seconds, but it can happen dozens of times every hour. Every interruption briefly lowers oxygen levels, forcing the brain to wake the body just enough to restart breathing. The person usually doesn't remember these interruptions the next morning. Instead, they wake up believing they slept through the night, even though their body spent hours struggling to breathe properly. Over time, untreated sleep apnea has been associated with higher risks of high blood pressure, irregular heart rhythms, stroke, heart failure, and other cardiovascular problems. It can also leave people feeling exhausted during the day, affecting memory, concentration, and mood. You don't have to diagnose yourself. That's the job of your healthcare provider. But you should pay attention if you or your family notice warning signs. Do you snore loudly almost every night? Has anyone ever told you that you stop breathing while you sleep? Do you wake up with headaches, a dry mouth, or overwhelming fatigue despite spending 8 hours in bed? These symptoms don't automatically mean you have sleep apnea, but they are certainly worth discussing with your doctor. A simple sleep study can often provide valuable answers and help determine whether treatment is needed. Many patients are hesitant when they first hear about treatments like CPAP therapy. They worry it will be uncomfortable or inconvenient. Yet countless people who stick with treatment report sleeping better, having more energy during the day, and, in many cases, improving important aspects of their overall cardiovascular health under their doctor's care. Sometimes the biggest threat isn't something you can see. It's something happening quietly while you're asleep. And just when you think you've covered the major risks, there's another surprisingly common evening habit that many older adults believe is protecting them. Ironically, it may be doing exactly the opposite. Before you dismiss it as unimportant, wait until you hear why hydration before bed could be far more important than most people realize. Now let's talk about a habit that surprises almost everyone I meet in the clinic. It sounds completely reasonable, and that's exactly why so many people never question it. Many adults over the age of 60 intentionally stop drinking water in the evening. Their reason is understandable. They don't want to wake up 2 or 3 times during the night to use the bathroom. A full night's sleep feels more important than another glass of water. So after dinner, they avoid fluids altogether. At first glance, that decision seems perfectly logical. But your body doesn't stop needing water just because you're asleep. Throughout the night, you continue to lose fluids through breathing and perspiration. Even if it's not noticeable, your body is constantly using water to support circulation, regulate temperature, and keep every organ functioning properly. By the time morning arrives, you've gone several hours without drinking anything. For many healthy people, this isn't a major concern, but for older adults, especially those living with heart disease, diabetes, or certain chronic conditions, mild dehydration can place additional strain on the body. When you're not adequately hydrated, your heart may need to work harder to circulate blood throughout your body. Dehydration can also contribute to dizziness, fatigue, low blood pressure when standing, and an increased risk of falls in some individuals. That's one reason doctors often encourage older adults to maintain healthy hydration throughout the day unless they've been instructed to limit fluids because of conditions such as heart failure or advanced kidney disease. The key isn't drinking excessive amounts of water right before climbing into bed. Instead, aim for consistent hydration throughout the day so you're not trying to catch up at night. If your doctor hasn't placed you on fluid restrictions, having a modest glass of water in the evening may be perfectly reasonable for many people. The exact amount depends on your health conditions, medications, and personal needs, so always follow the advice that's appropriate for you. Another helpful habit is to pay attention to the signals your body gives you. If your mouth feels dry, your urine becomes unusually dark, or you frequently feel dizzy when standing, those can sometimes be signs that you need to discuss your hydration with your healthcare provider. Small daily habits often have a much greater impact than people realize. Now let's move from what's happening inside your body to something most people never connect with heart health at all: your bedroom. Think about the temperature where you sleep tonight. Most people adjust the thermostat based on comfort alone. Some enjoy a warm, cozy bedroom. Others prefer it cool enough to sleep under thick blankets. But temperature can influence sleep quality, and sleep quality plays an important role in overall cardiovascular health. If a bedroom is excessively warm, you may sweat more, wake frequently, and spend less time in the deeper stages of sleep that help your body recover. Poor sleep over months or years has been linked with higher risks of several chronic health conditions, including high blood pressure and heart disease. On the other hand, an extremely cold room may also be uncomfortable for some people, particularly older adults who already have circulation problems. Most sleep experts recommend maintaining a cool, comfortable sleeping environment. For many people, a bedroom temperature around 65 to 68 degrees Fahrenheit promotes quality sleep, although personal comfort can vary. Just as important as temperature is the atmosphere you create before bedtime. Bright phone screens, exciting television shows, stressful news, and emotionally charged conversations keep your brain active long after you turn off the lights. Your heart responds to stress just as much as your mind does. Instead of ending your day with anxiety, try replacing those final 30 minutes with something calming. Read a book. Listen to relaxing music. Practice gentle stretching. Spend a few quiet moments with your spouse or family. Even a slow walk after dinner, if your healthcare provider says it's safe for you, can become part of a healthier evening routine. These changes may seem ordinary, but healthy aging rarely depends on one dramatic decision. It is usually built from dozens of small choices repeated every single day. If this video has helped you look at your evenings in a different way, I'd truly appreciate it if you would leave a like and share it with someone you care about. You never know who might benefit from information that encourages healthier habits before bedtime. But before we finish, there's one final lesson I want to share with you. After years of caring for patients and speaking with families after life-changing emergencies, I've noticed one truth that outweighs everything else. It isn't a medication. It isn't a special diet. And it doesn't cost a single dollar. In many ways, it may be the most important habit of all. Part 4. After spending years caring for people with heart disease, I've learned that the greatest difference between those who protect their heart and those who unknowingly place it at risk is rarely luck. More often, it's awareness. The people who understand how their daily habits affect their health are usually the ones who make small adjustments before a serious problem develops. I remember speaking with a patient in his early 70s during a routine follow-up appointment. He smiled and said, "Doctor, I don't smoke. I don't drink much. I thought I was doing everything right." And in many ways, he was. But as we talked about his evenings, a different picture emerged. He regularly ate large meals just before bed, stayed awake watching television until after midnight, ignored his loud snoring because his wife had complained about it for years, and rarely drank enough water during the day because he disliked frequent trips to the bathroom. None of those habits seemed dangerous on their own. But together, night after night, year after year, they created unnecessary strain on a heart that was already working harder because of age and high blood pressure. The encouraging news is that improving your heart health doesn't always require dramatic changes. It begins with simple, realistic decisions that you can start making tonight. Try finishing dinner a little earlier whenever possible so your body has time to digest before sleep. If you take medication for blood pressure or another heart condition, continue taking it exactly as prescribed. And if you've ever wondered whether the timing is right, Ask your healthcare provider during your next appointment rather than making changes yourself. If your family tells you that you snore loudly, stop breathing during sleep, or gasp for air, don't laugh it off. Bring it up with your doctor. A sleep evaluation could provide important answers that improve both your sleep and your long-term health. Stay hydrated throughout the day, following your doctor's advice if you have a condition that requires fluid restrictions. Healthy hydration is about consistency, not drinking excessive amounts at bedtime. Create a bedroom environment that helps your body rest. Keep it comfortably cool, reduce unnecessary noise and light, and give yourself time to unwind before sleep instead of carrying the stress of the entire day into bed. These may seem like ordinary habits, but ordinary habits shape extraordinary outcomes over time. Your heart has been working every minute of every day since before you were born. It has never taken a vacation. It has continued beating through every celebration, every challenge, every illness, every moment of joy, and every moment of grief. The least we can do is give it the conditions it needs to continue serving us well. Remember, no video on the internet can replace personalized medical care. If you have chest pain, sudden shortness of breath, fainting, symptoms of a stroke, or any other medical emergency, seek immediate medical attention. And before making changes to medications, diet, or fluid intake, especially if you have heart disease, kidney disease, or diabetes, always consult the healthcare professional who knows your medical history. I hope today's discussion encourages you to look at your evening routine with fresh eyes. Small improvements made consistently are often far more powerful than drastic changes that last only a few days. I'm Dr. Will, and my goal has always been to help you make informed decisions that support a healthier, longer life. If even one idea from this video inspires you to have a meaningful conversation with your doctor or adopt a healthier bedtime habit, then our time together has been worthwhile. If you found this video helpful, please subscribe to the channel and turn on the notification bell so you don't miss future videos. Share this with a friend, spouse, parent, or loved one who may benefit from these simple, heart-healthy habits. And before you go, I'd love to hear from you in the comments. Which evening habit are you going to improve first? Your answer might encourage someone else to take that important first step toward better heart health.